So dear friends, so we are going to discuss few points of the Master Tung. And every day we are getting the patients where we can use them. So let's start the discussion with the introduction of the greatest acupuncture scientist and acupuncturist, Master Tung. Master Tung was working in the army. Professionally, he was not having any degree. Professionally, he was not having any degree of the doctor. And because of not having degree, even Master Tung faced lots of difficulty to practice this medicine. Many times he struggled a lot to practice this system because of not having professional degree. Because Master Tung has learned this thing from his family. And this is the Dr. Tung's points, where it treasures family secret. Means the Dr. Tung family, the Master Tung family, were not sharing this secret to anyone. They were just passing this information to only their families. So Master Tung was a traditional Chinese physician and he was from northern China, Shandong province. He was on this earth till 1975, and after that he left his body, but prepared some students and also few books because of their student like Dr. Miriam Lee, Dr. Wee Yong. Now this therapy has gone to the United States and they have written many books in the English and they have taught to many medical doctors. So now we can learn from them. As per the Master Tung, we should not use lots of needle. As per the Master Tung, only 6 to 8 needles are maximum and are enough. Only 6 to 8 points. Like in traditional Chinese medicine, if you see many practitioners, they're using 50, 60, 70, 80 needles in per sitting. Even patients are getting benefit from the traditional Chinese medicine. But when we talk about the Master Tung, many times he was using just only 2 needles, only 1 needle, 3 needles, and maximum to maximum 5, 6 needles. Because Master Tung points are very much effective. So these much points are very much enough. Sometimes we have seen only 2 points like Lingu and Dawai. Just only 2 points are enough to cure the back pain. Many of us already have this experience. And in the Master Tung, we use the points only one side. We don't use the point on both the sides because of having very strong effect. So we don't want to overstimulate the points. And there is one very good facility in the Master Tung. As per the Master Tung, if you miss the points, even after that, you are going to get the results. But you should not miss the line. You should not miss the channel. You should put the point on the right channel. And after that, if you are missing the points, no problem. Even after that, you are going to achieve the results. So let's start discuss the most important points of the Master Tung, which has been cured lakhs of patients in last many years. And this is the very famous point for fertility. And this is called Phuke or 11.24. The 11.24 point or Phuke point is very much useful for the infertility. And this point is useful only for female. So we are remembering this point, like F for female, F for female, and F for F line. In the fingers, we are having multiple lines. Shortly, we will discuss. In these multiple lines, we are having this point on the F line. So F for female, F for F line, and we are inserting 2 needles on the marsupial Phuke points in the F line, in the thumb. And this is one of the best points for infertility. Not only infertility, but all the female gynecological problems. As per my experience, I have seen one female suffering with the nodule in the cyst, nodule in the breast, one female suffering. Breast nodule. So there's a female, and she was having some unwanted growth in the right breast. So as per the master tool, this point useful for all the female disorder. Either this is the problem of the uterus, ovary, or this is the problem connected with the breast. So as per the master tool, 11.24 or Phuke point, which is on the F line on the thumb. If you insert this point, this is very good for all the female problems. All the female problems, like either this is the problem of the breast, like benign or malignant cyst or unwanted growth in the breast, or this is the problem of ovary. Like there was one female came for the treatment of ovarian cyst, and I committed that I will give 12 sittings and definitely we will see very good results. But just after 5 sittings, he went again for the ultrasonography and he saw just within 5 sittings where I inserted the 11.24 point, cyst disappeared. So 11.24 has been proved by hundred acupuncturists that this is one of the best points for all the female genital problem, all the female reproductive problem. And this point is famous with the name of Phuke. Phuke. When we divide any finger, like this is the finger, and we are seeing this finger from the front and back. Let's try to understand. This is one human body. Just we are taking this as an example, and we are seeing from the front and back. Now, if we see the center line, suppose the center line is a C. Now, make all the line in that way, like A, B, C, in that way. So A, B, C, D, and E. So in the same way, if we do the division in the finger, so this is the finger, any finger, and the central line is a C. The line who is in the side, that is A, C. In between we are having B, then D, then on the corner, that is E. So it's very simple to do the division of any finger. Even if we see the thumb, let's see the thumb, this is the thumb. And this thumb is attached with other finger, with the index finger, and this is the thumb. And we are seeing the palmar surface of thumb. So central line is C. Now, the side line is A, then B, then C, then D, and then E. So in this way, we are doing the division in the master ring of each and every finger. So we are dividing equally in 5 parts from the front side, every finger, including thumb. Same way, if we see from the dorsal side, so let's see. If we see from the dorsal side, so this is the front side, and this is the dorsal side. So now, the central line is C, that we know. A, B, C, D, and E. We are having 5 lines in the front side. So I will show you the same thing in one human image for better understanding. So let's see any finger. So we are looking the thumb. Because this division is useful for each and every finger, so we should know this division. So this is the thumb, and the central line is a C. And we are starting counting from this side. So A, B, C, D, and the corner line, lateral line, border line is E. I think now it is understood. If we go in the dorsal side, so we can see E is coming in the inner side. Now I am turning and going to the dorsal side. Now look at the finger, look at the thumb from the dorsal side, from the dorsal view. So we have already come till here. So here we have come on the side, that is E line. And we have started our journey from this side, that is A line. Because this is on the lateral border. So this will be the common, A and E. Now, in the back side, there is the central line and one line we are having here. So E, F, G, H, in that way we are doing the division. Right now, forget all the things. Just remember F line, F line. So in the F line, we are having these female points. Either you are acupuncturist, either you are master tongue acupuncturist, or you are traditional acupuncturist. But today onwards, you will be able to look at this F line. So this F line is here. Let's see in the maze for better understanding. So female points are available in the F line. This is the very famous sentence. If we see the skull, Then now we can understand this thing more easily. Look at the thumb. So look at the thumb. We know that this is just a skeleton. But when we talk about the real body having muscle and skin also. So suppose this much is a muscle and skin. Now becoming a complete thumb. So the F point is available just on the border of this bone, just border of this bone. That is F line. So what we are doing? How we are searching? What we are doing? Let's see. If you see my thumb and the thumb, try to feel the border bone. Try to feel this border bone. This is the F line. So when I'm feeling the border bone, this F line or the female point or Fouquet point are available on the F line. Now, leave the upper phalanges. Now coming back to the lower phalanges. So these 2 points are available at equal distance in the F line, one here and one here, one here and one here. So this is called Fouquet. So in this way, now we have understood exact location of Fouquet, because I have seen the great results of Fouquet. My first patient in my life came with the complaint of breast cyst, and I used this point. Within 15 to 20 minutes, the breast nodule become very large and 30% reduced in the size. That was my first patient. I used Master Tung points. So I started my Master Tung journey from the 11.24 point of Fouquet point. And I was so surprised then how within few minutes only, any points can reduce the size of the breast cyst or breast nodule. So that's why I started today with the same points, Fouquet. It is very much effective. I have seen the great results in the PCOS or polycystic ovary. So you can also try the PCOS or polycystic ovarian syndrome. It is very effective point for the ovarian cyst. It is very effective point for all the gynecological problems. Either this is menstrual problem, delay menses, excessive bleeding during the menstruation, lesser bleeding during the menstruation, or any problem which is happening and which is connected with the periods. This point alone is enough. It is so effective point. It is very good at points for the white discharge, reddish discharge. If someone is suffering with the problem of cervix, infection, inflammation of the cervix, it is very good point for the endometriosis. All the problem connected with the uterus. This point, one of the best point. Now the thing happened. We are not using this point for the male. For male, we are having another point that is 11.06. 11.06 point we are using for the male, but this point useful only for the female. Now, the question comes, why? You can ask me why this point is effective for these problems. Can you tell me some scientific reason that why this point is useful for all the female reproductive problems? What is the science? What is the reason behind that? Yes, so I would like to tell the science behind this point. So let's see. Because as an acupuncturist, we should know everything, why any point working for a specific problem. So when we talk about the Fouquet or 11.24 point. See, this point is available in the thumb. This point available in the thumb. That is clear. As per the master tomb, this is the thumb, index finger, middle finger, ring finger, and a small finger. As per the master room, thumb under the energy of lung, index finger under the energy of large intestine, middle finger under control of pericardium, the ring finger under control of triple barmer, a small finger under the control of heart and small intestine. So now, when we talk about the thumb, you insert the point anywhere in the thumb. As per the master tomb, it is the under influence of lung. So now, what is the connectivity of lung and reproductive part? What is connectivity of lung with the breast? What is connectivity of the lung with the female gynecological problems? Whether lung is connected. So as per the master tomb, the Dr. Tan has been explained this thing very nicely. Lung, as per the organ clock, the timing of lung is 3 to 5 a.m. in the morning. And as per the acupuncture, if we see the organ clock, in the night time, 1 to 3 is the time of liver. 1 to 3 a.m. is the time of liver. Then just after liver, 3 to 5 a.m., it is the time of lung. So they are having never relationship. They are never. And organ clock cycle having the significance because the never influence each other. Never always influence each other. The liver is influencing the lung is influencing the liver. If something happened wrong with the liver, it affects the lungs. And something happened wrong with the lungs, it affecting the liver because they are having never relationship. So when we are inserting the needle in the thumb, and thumb is a lung, it is directly working on the liver. And as per the acupuncture, liver is the organ who supply blood to the uterus. Liver is the organ who control the breast. Liver is the organ who is connected with the genital part. Liver is the ATM machine. Liver is the ATM machine who store blood, and time to time he supply blood to the uterus. If there is a lack of blood in the uterus, then we always think about the liver deficiency. If there is excessive bleeding from the uterus, we always think about the liver excessive heat. If liver is weak, uterine bleeding will be poor. If liver heat is plus, uterine bleeding will be more. So that's why when we insert the needle in the F line, when we insert the needle in the thumb, and when we treat the lung, it is directly working on the liver. So it is working for all the female reproductive problems. And with the time it has been proven that if you want to treat any female for any female reproductive problem, you should start from the Fouquet point, Fouquet or 11.24. If someone is suffering with a painful menstruation, then you can see the results within 1 or 2 sittings. Fouquet is very much effective point. So we have discussed the relationship between lungs and liver. There are multiple relationships. I don't want to confuse anyone, but I would like to discuss one more relationship of lung. We know the lung and spleen. Lung and spleen both are coming in the one family only, and the name of this family is Thyin. The meaning of Thyin, lung and spleen. Lung is called upper Thyin and spleen is called lower Thyin. So lung is supplying the upper part and spleen is supplying the lower part. When we do something in the lung, it is affecting the spleen, and when we do something with the spleen, it is affecting the lungs. Lung and spleen like a one river. This is called the river of Thyin. So lung and spleen are a one river. But in the upper part, we are telling lung. In the lower part, we are telling spleen. Both are the same channel. So that's why many persons are telling the lung and spleen both together are called long meridian. The meaning of long meridian, because they are the single meridian. But in the upper part, we have given the name lungs, and in the lower part, we are telling them spleen. So, because both are the same meridian, because both are the same river, and same river contains the same water, if you do something wrong with the spleen, it will affect the lung. And if you do something wrong with the lung, it will affect the spleen. That's why in the acupuncture, when you want to treat the allergy, in the acupuncture, when you want to treat any types of lung allergy, you will find most of the point on the spleen. So the question comes, why you are treating point on the spleen when lung is in the problem? The reason, lung and spleen both are interconnected with this channel relationship. So when we are inserting needle in the lung, in the thumb, it will also correct the spleen. And as per the acupuncture, spleen is the meridian who is the controller of all hormonal problems, either in the male or in the female, especially in the female. And spleen is the organ who is making the blood. And we know for the female, blood is very important thing because every month they are losing the blood with the menstrual cycle. So they are having more tendency of blood deficiency. So now, when we insert needle in the lung, it is affecting the liver. It is also affecting the spleen. So that's why it is good for genital part. And also it is good for all the hormones. And because hormones are connected with the ovary and genital part. So now it has, so this proves that Fouquet point or 11.24 point is one of the best points for all the female reproductive problems, and just two needles in the thumb in the F line can treat the multiple problems of the female. So we are going to organize the detailed workshops in the month of November, and from the 21st November we are going to study 40 days continuous workshop on Master Tung. So if you want to go into more detail, you can also enroll for that. But today my intention to tell you lots of good information. So whether you want to join the workshop or not, no problem. But today you are going to learn lots of things. Just for a minute, I will give you the information because someone asked. So Master Tung detailed workshops, we are starting from the 21st November. That will be the 40 days workshops. And timing will be 3 p.m. or 5 p.m. onwards. And we will finish the Master Tung detail in 40 days. So if anyone want to enroll, they can send the message in the group or directly to me on my number, and they can enroll via the link. So let's discuss few more points. And if you don't know my number is 816-00-88-512. This is my number. Master Tung acupuncture is very effective because I have taken multiple workshops throughout the India before this lockdown. And most of my student has told that after learning Master Tung, we have become the famous in our area because of the effectiveness of these points. Results appear on the table. Results appear very instantly. And you will able to develop your rapport within 1 or 2 days only. Then you can combine the Master Tung points or traditional acupuncture points or any other points. But Master Tung points will make your rapport, because when patient coming with lots of pain and you are able to relieve the patient within 1 or 2 days, then he do the surrender in front of you. Now the patient will tell you, now doctor, you do whatever you want. Now I am having completely faith on you. So Master Tung is very good for that. So let's see other point. Now, this point is very effective because I have also having one story which is connected with this point. I was doing one camp. I was doing one camp of acupuncture where I was treating lots of patients with the acupuncture. And nowadays, there are many patients suffering with the heart problem. Nowadays, many patients, they are suffering with the breathing discomfort, and this breathing discomfort because of the heart. Because in the chest cavity, we are having two important organ. One is lung and one is heart. One is lung and one is heart. So if someone is suffering with any problem which is connected with the heart, and if someone is suffering with any problem which is connected with the heart, like a palpitation, like a breathing discomfort or shortness of the breath. So one day I inserted this point to one lady. This point is very easy to locate because in the lower phalanges, just if you go in the center, so this point is located, and you have to prick the needle little bit only to point to chun or to fan, very little. And this point is called center crevice 11 or 11.01. And the next day onwards, that lady never got the palpitation and breathing discomfort, because I have treated many patients but for the many patients we need many sittings. But sometimes what happened, one single sitting and single needle can do wonder. So this is a very common point we are using clinically in the lower phalanges, in the center of the lower phalanges, which is the greater point for any heart connected problem, any heart related disorder. or it is called center crevice, 11.05. Even this point is having many other effect also, many other multiple effect also. But right now, I want to focus, bring your focus only on the heart. Because when we discuss lots of indication, then we forgot main indication. So the main indication of this point is very much effective for any heart related disorder. There are many other points in the same finger, in the index finger. They are also effective for lungs and heart. But out of these all points, this is one of the best points. Now question comes, why? Why this point is effective for the heart problem? What is the connection of index finger and heart? Because in the index finger, even we don't see the heart meridian. So why this point is connected with all the heart related disorders? Why this point is treating the palpitation? Why this point is treating shortness of the breath? Because of the heart discomfort. Let's see the scientific reason behind this. So before proceeding, let's see one meridian. So let's see, this is the meridian. The name of this meridian is stomach meridian, starting from the midpoint of the eyes, going down, supplying lots of face area. After supplying the face area, then it is going in the throat region. Then finally, it is entering in the chest region. So we can see multiple points, stomach 12, 13, 14, 15, 16, 17, 18. There are multiple points available on the chest cavity, right side and left side both. And they are supplying the chest cavity, they are supplying the nipple area, they are supplying the breast, they are supplying the lungs, even they are supplying the heart. So this is the acupuncture river. This is the acupuncture meridian who is supplying this area. So if anything happened wrong with this area, we can treat the stomach meridian. The meaning of the stomach meridian is not just like treating the stomach. Never think that stomach meridian will treat only if someone is suffering with the problem of stomach, if someone is suffering with the problem of gas, acidity, and indigestion. Definitely they will be treated, but stomach meridian will treat all the problem wherever this meridian is going. Like this meridian is passing from the chest cavity, so we are finding multiple points on the stomach meridian. They are good for lungs and heart. Okay, so now in the acupuncture, there is one family. The name of this family is Yang Ming. Yang Ming. The meaning of Yang Ming, what is Yang Ming? Yang Ming is a one meridian, very long meridian, very long meridian. And we have divided this meridian in two parts. In the upper part, we are telling upper Yang Ming. And in the lower part, we are telling lower Yang Ming. Upper Yang Ming also called large intestine, and lower Yang Ming also called stomach. So large intestine and stomach both are same river. Just we have given the different name. In the upper part, we are telling large intestine, and in the other part, we are telling stomach. So large intestine and stomach are the same river, having same water. So when we do something with the large intestine, it will affect the stomach. And when we do something with the stomach, it will affect the large intestine. They are affecting each other. Like they're same river. So water is the same, energy is the same. So now, when we put any point in the index finger means large intestine. So it is affecting the stomach. Just we have seen here. Just we have seen this index finger. Index finger as per the master term is large intestine. You put point anywhere in the index finger, it will be connected with the large intestine. 1 minute only. So when we do something with the large intestine, it will directly affect the stomach. And when we do something with the stomach, it will directly affect the large intestine. So when we do something in the index finger, it will directly affect the large intestine because index finger is the large intestine as per the master tongue. So index finger, either you put the point in the front side, back side, lateral side, medial side, any side in the index finger. As per the master tongue, this point will be large intestine point. So this point directly will affect the stomach because LI and the stomach both are same. So putting the point in the LI is very effective for the chest cavity, very effective for the lungs, very effective for the heart. So putting the point in the index finger will bring betterment in the lung disease and heart disease, both. So right now we have discussed the point 11.05 or central crevice. The 11.05 or central crevice, which is a very effective point in the index finger. So this is the index finger. And this is the middle finger. In the index finger, just this is a central point, 11.05, just into the single point here. And you will see the greater results. Even you can advise some patient to do the acupressure here on this point. Doing the acupressure every day also bring very good effect on the heart condition. So breathing discomfort, palpitation, high or lower blood pressure, any heart condition, this point is very good. Let's proceed now. So now we are going to discuss very effective point in the master tongue acupuncture for knee pain. These points we are going to discuss in the middle finger. As per the master tongue, middle finger is the finger of pericardium. And we know what is pericardium. Pericardium is the covering of heart. And this is the famous statement of the master tongue. If you want to treat the knee, if you want to treat knee, then treat the heart. This is a very famous statement of the master tongue. Just treat the heart point. Any heart point in the body will treat the knee pain. So in the master tongue acupuncture, if somewhere written that this point is good for heart, then definitely it will be good for knee pain. So right now, when we talk about the middle finger, middle finger is the finger of pericardium because pericardium meridian going in the finger. And we know what is pericardium? Pericardium is the covering of heart. The pericardium is the covering of heart. So what function done by the heart? Same function done by the pericardium. So in the middle finger, we will get very good point for the knee pain. Second thing, as per the many scholars, when we ask them, describe the pericardium, so they describe as per the acupuncture. What is pericardium? Number one, the covering of heart. Number two, the covering of brain. That's why the other name of pericardium meridian is the brain meridian. It means if you do something in the pericardium finger, it will affect the heart. It will affect the brain. And because it is affecting the heart, so this will affect the knee as well. So if you want to treat these three things, definitely you should go in the middle finger and search the point. Because the middle finger is the finger of pericardium and the middle finger is the finger of brain. So now simple, if we see the correspondence, as per the correspondence, suppose this is the middle finger. So this is the eyes, this is the chest cavity. In the chest cavity, we are having two lungs. In the center, we are having heart. And here, we are having the lower part or reproductive part. Here we are having all the abdominal part, lower part, and even reproductive part. So simply, this is the upper body, this is the middle body, and this is the lower body. And we know each and every finger represent a complete body as per the correspondence system. So Master Tung has used the correspondence system everywhere. He used the correspondence system in each and every finger. He used the correspondence system in each and every bone. He used the correspondence system at many places. Correspondence system has been taken origin from the Master Tung only. So if we divide the index finger in three parts, upper and middle and lower body, upper body in the upper phalanges, middle body in the middle phalanges, and lower body in the lower phalanges. Right now, if you want to treat the heart, so you have to treat in the middle phalanges. So if you want to treat the heart, you will treat in the middle phalanges. So let's see if this is the middle finger and we are looking the middle finger from the dorsal side. So these are the 2 points and they are called 11.09. The name of this point is heart knee point. The name of these points are heart knee point. So where we are using these points? Suppose there is one patient, like one patient is standing like that. And this patient complaining you, doctor, I am having pain somewhere here near the scapular region, near this part. So pain near scapula. pain in the middle back. So when we, in this condition, when we use the 11.09 points, and we are getting the result very immediately, because 11.09 point is the point, because if this is the upper body, this is the middle body, this is the middle body. And believe me, the 11.0 point is very effective, working very instantly for the pain happening on the border of the scapula. I have tried this point many times. So this is the patient. This is the patient asking you that can you treat the pain happening here? Because we know the scapula is here, the bone is here. So he's asking you, can you treat the pain happening on the border of the scapula or in the mid back here? Either this pain connected with the heart, or we can see heart is near in this area only. So either this point is connected with the heart, or this point is not connected with the heart. If this point is, this pain is happening in this scapular region, on the border of the scapula, on the middle back, on the lower border of the scapula, then you should use the 11.09 point or heart knee point. So first we are using this point for the heart disease. And second, because Master Tung told all the point useful for the heart, also very much useful for the knee pain. So if someone is suffering with the knee pain, use the 11.09 points on the opposite side. So let's see in this middle finger, the location of points. So we can see this is the middle phalange. And inside we are having phalangeal bone. This is the phalangeal bone. On the border of phalangeal bone, we are having this 11.09 point. So we have to insert the needle perpendicular here. Insert the needle on the border bone and see the results very immediately. Within few minutes, only few minutes, 3 to 7 minutes, you will see the pain on the scapular region has been disappeared. And also shortly, you will see the results. Knee pain is much better. So if scapular pain is independent, or if scapular pain is connected with the heart, in both conditions, this heart knee point is very much effective. Let's see this point in the other image. Here we can see the middle finger. In the middle finger, we are having 3 phalanges. This is the 1, this is the 2, and this is the 3. So in the middle phalanges, on the border of bone, we are having this point. So we have to insert the needle so that it will go on the border of bone. And this is got 11.09 point or heart knee point, which is very good for the heart, which is very good for the knee pain, and which is very, very good for the pain happening in the middle back or pain in the scapula. So you know, just 2 needle Insert the two needles enough. Do not try to think, oh, I should use multiple needles. Or insert two or three more needles. 4 or 5 points are enough in the master tomb. Lots of points are not needed. So this is called 11.09. Now I will tell you one another point. There is one therapist who is working with me. One day she told me that, can you tell me some points so I can insert to my father? Because my father is getting, sometimes is becoming like a mad, throwing the things here and there. He is getting the attack, like an attack of hysteria, the attack of madness, the attack of manic behavior or mania. I asked her why it is happening with him. What is the reason? So she told that because of someone has taken our land. Now there are lots of dispute in the families. So he's suppressing lots of emotion. So because of that, he's suffering with this problem. So in this way, she asked me, can you tell me some points so I can insert so that he will get the benefit in the hysteric attack, manic attack, mania, the attack of this madness. So as per the acupuncture, why this happen? As per the acupuncture, when heart is overlapped by flame. Heart is overlapped by invisible flame. That time, person is getting hysteric attack. And the same thing when it happened with the children. They are crying in the night. So night crying and fear in the children happening because of the same reason. So our responsibility to remove that flame from the heart, to remove that unwanted deposition from the heart. How can we do that? So we can do that with the 11.13. 11.13 point is available here. In this image, we can see. These are the 11.13 point in the first image. Like 11.09 point in the middle phalanges and the same 11.13 point in the lower phalanges. Because these points are available in the pericardium finger, so connected with the heart and removing the invisible flame from the heart. So let's see in the other image. If you see this image and if you see the lower phalanges, so just 2 points here, and they are called 11.13. And these points are removing the unwanted flame, invisible flame from the heart. So if someone is having some heaviness in the heart, because sometimes you know that sometimes what happened? Everything is right. But because of emotional suppression, you feel some heaviness on the heart. That is not because of some reason, but that is because of some emotional reason, because of your sensitive behavior. So the 11.13 points available in the both side of the lower phalange in the middle finger. And when we insert the needle here, this point immediately removing the unwanted flame, which is overlapping your heart. Removing the unwanted flame from the heart, bringing lightness in the heart, bringing calmness in the heart, your shen, your mind, your brain becoming very calm. Then you are not behaving like a mad. Children are not crying in the night. Children are not in the phobia and fear. So this point, 11.13 point is very good for the children fear. Very good for the night crying in the children. And this point is available in the middle finger, the lower phalanges. Let's see one of the very excellent point in the Master Tung Acupuncture. Good anger point or 11.17. As per the name of this point, wood anger, the name itself explains everything about this point. This point is very much effective for the anger management, and this name has been given by Miriam Lee, who is the very great scholar, learned the acupuncture from the Vichy Yong, and Vichy Yong, the direct disciple of the Master Tung. So we can see the second generation disciple of the Master Tung, Miriam Lee. The Miriam Lee has done lots of research on this point, wood anger point 11.17, which is in the index finger. So we can see in here index finger. In the index finger, this is the D line. On the D line, or at the equal distance, on the border bone, we are having these points. Wood anger point is very effective for anger management. I have tried this point for many patients who are having unwanted anger. The question comes, why this point is good for anger? What is the relationship between index finger and anger? So the answer is this. I already told you the index finger is connected with the large intestine. And when you go in the deeper of the master tung, that time you will see the large intestine is connected with the liver, and liver is connected with the anger. So how large intestine connected with the liver and anger? Let's see. Because this is a very detailed subject. And learning the master tung means learning all the concepts behind each and every point. So when we talk about the large intestine and stomach both belong to the Yang Ming family. Yang Ming family. The meaning of Yang Ming in the upper part, large intestine, in the lower part, it is stomach. And the other family, that is Zhuin. Zhuin family, in the upper part, we are telling pericardium, and in the lower part, we are telling liver. So Zhuin family having two meridian. Right now, I want to tell you only one thing, that these Yangming and Zhuin both belong to each other, both affecting each other. If something happened wrong with a Yangming, then we are taking help of Zhuin and vice versa. So they are affecting in the cross pattern. So something happened wrong with the pericardium, we are working on the stomach. That's why if someone is suffering with the acidity, we are taking the pericardium 6 point. Why pericardium 6 point working for the acidity? Because of this relationship. In the same way, large intestine and liver both are affecting each other. The large intestine and liver both are very deeply interconnected. That's why in the TCM also, large intestine and large intestine 4 bilateral and liver 3 bilateral, these are the very famous point and called foregate, because the large intestine and liver both are very deeply interconnected. So when we are putting the point in the index finger, it is working for the liver and vice versa. And liver is connected with anger. If someone is having liver imbalance, so he will suffer with the anger. So now, coming back to this point, The Bud anger point or 11.17 point available in the index finger, and just we understood the relationship of large intestine and liver. So that's why, because this is the finger of large intestine, index finger is the finger of large intestine, and it is connected with the liver so that it is connected with anger. So 11.17 point called Bud anger point. 11.17 point are useful for the liver. And when we talk about the liver and liver channel in the human body, liver channel is the channel who is supplying the genitals. Liver channel is the channel who is supplying the breast. Liver channel is the channel who is supplying the throat region. Liver channel is the channel who is supplying the eyes and brain. You will ask why? How eyes? When you go to the doctor and your eyes are yellow, then doctor will tell, oh, check your liver. You may have jaundice. And when your eyes are red, maybe liver heat is plus plus. When liver is affected, you will having some emotional ups and down and brain disorders, mood swings. Liver is very deeply connected with the brain. So if someone is suffering with anger, we can use 11.17. Someone is suffering with the eye problem like dryness in eyes. The meaning of dryness of eyes, that no tear formation. Then also we use 11.17. And if someone is suffering with the excessive tear from the eyes, then also we use 11.17. So any problem which is connected with eyes, either tear is not forming or tear is draining down, excessive tearing from the eyes. In the dryness of the eye, in the excessive tearing of the eyes, we use 11.17. That's why 11.17 point called Bud anger point, because it is useful for the anger, also called common cold point. Because this point is crossing in the common cold we see, in common cold our water is coming from the nose and also eyes become red and inflamed. So 11.17 point is very effective for even common cold in the running nose. So if someone is suffering with the problem of the eyes, with the problem of the nose, like common cold, with the problem of the brain, like anger, like tearing, like running nose, the 11.17 work very nicely. Especially you can remember this point for the tearing and running nose. See, even you can insert the needle in the children because you can use the sujog needle. But if you can't insert the needle, then you can do the acupressure. Or you can use the star magnet. Yeah, so we have to use if someone is suffering with the left knee pain, we will use the point on the right side. And if someone is suffering with the right knee pain, we will use point on the left side. Why opposite side? No, needle is very effective. But if needle is not possible, you can use the star magnet. Definitely, acupressure is also effective. You can do the treatment at any time, because if you want to go with the time, then it will become very difficult. If you are going with the time, then timing of the liver in the night 1 to 3 a.m. it is very difficult for the clinical practice. So better you do any at any time. Yeah, so no problem with the time. So because even all the practitioners, including me, are working in our clinical time, and we are getting the results. These points are master tongue points. Like in the master tongue, these points are not Dr. Bowl point, and only few points. Master tongue also has used some TCM point like pericardium 6, but many other points are very much different. We have already seen. See, yeah, very good question. For the anger, which side needling? Yeah, very nice. See, if you want to treat the anger, if you want to treat the liver, even Master Tung has been accepted this. If you want to treat the liver, so treat in the left side. In the human body, physically, the location of liver is the right side. But when we talk about as per the yin and yang energy concept, the liver is a great general, the liver is a great fighter, the liver is having yang energy more. So liver points are more effective on the left side. So we are using 11.17 point and many other liver point effectively in the left side only. 11.17 are very good for the runny nose, whatever the reason is, any viral infection, including COVID. Master tongue acupuncture points are useful for the acute problem and for the chronic problem both. Master tongue has told that if you want to treat the any disease, either this is the acute and chronic, so you can treat in the upper body part. Upper body part means either in the fingers or in the arms or in the scalp. But if you want to treat very chronic problem like psoriasis or eczema since 10 years, since 15 years, and very deep related problem, very chronic problem. So as per the Master Tung, you should treat them in the lower body part. So I have to cover more points. So because some questions automatically will be solved, and many questions cannot be solved because each and every point required a detailed explanation. So some of the point will be explained. All points is difficult to explain. Yeah. For the Parkinson, we are having very effective point protocol in the master room. For the lower sperm count, we are having very effective points. Lower three emperor. Lower three emperor are very good for the sperm count. And upper three yellows are very effective for the Parkinson. Upper three yellows. And multiple points on the spleen meridian, like lower three emperor. And the tiger points. Tiger points are very good for the rheumatoid arthritis. So we can go only slowly. Okay. The tiger points, 5 tiger points are very effective for the rheumatoid arthritis patient. rheumatoid arthritis. We can use 11.17 in the COVID-19 and runny nose. Yes, definitely. No, we are not doing in that way. We are doing any times. Infertility we can use because we are doing the treatment for bringing the balance in each and every body part. Because when we are inserting the Foucault point, it is if it is working on the spleen or hormones, as well as it is working on the liver. So it is correcting the energy in that pathway, which is blocked. So let's proceed now. We will see one or two more points because it is already 7:20. I was having my intention to share more points, but time is running so fast. Okay, so what we can do, we can do one more class on some other day because I want to share a few more points, but time is not permitting. One, two, three, four, five. Okay, so we will decide the time very shortly and we will do the mastering because the thing is this. If you ask me the protocol for this and that, then it is very difficult. But if you want to go in very detail, then you can learn the system systematically. 1 minute. So we will decide one more day. And also, we are doing our Master Tung Acupuncture workshops from 21st November. So 21st November will be first day and we will do the 40 days workshops in the evening time every day. Language will be English. So if anyone want to enroll, I will post the link in the group. You can enroll with the help of link. Okay. And one more thing, I will answer few questions. All the questions, and I will answer a few questions if they are related. So we'll see the few questions. Okay. Uh, See, what is the reason have a question? What is the reason of having ghabrahat and breathing problem if you sleep in the left curvat at age of 55? So someone is sleeping on the left side, left curvat. See, there may be many conditions. There may be many conditions, and as per the access rule, if someone is suffering with the problem in the when he take the curve, so there is a heart excessive. Heart energy if excessive, if heart energy is excessive, then person will be having problem when he sleep on the left side. So today we have discussed 11.05 point, which is very good for heart. In the Master Tung Acupuncture, we are having one more point that is 33.12, very effective. It will resolve the problem immediately. 33.12, I will note down and I will discuss this point in our next workshop, which we'll do in few days only. I will discuss. That is very effective point for the heart condition. 11.12 or heart point. No, I completed. I told that runny nose because of any reason, whatever the reason is for runny nose. Either this is the COVID virus or any other virus. We can work, we can, with the help of 11.17. See, psoriasis treatment, already I have taken one protocol which is coming, but now we will discuss after a few days, maybe after 3 days, we will do again. Psoriasis protocol I'm going to discuss, and it is very effective. Yeah, in the master term, we don't do tonification, we don't do sedation, we just do the needling, even method. If you want to treat the ankylosing spondylosis, lingo dava is helpful, but lingo dava is not complete. You need to add more points. The heart is having excessive energy. In that condition, person will be having difficulty when he sleep on the left side. Yeah, definitely I will explain the tiger point, but wait for 2 days. 2 days. After 2 days we can do, because each and every point require detailed explanation. Tung and ten both are interconnected. So that's why whenever we are doing tung, before or after, we are also learning the ten. If you want to learn the tung acupuncture, you should have the ideas of the ten also. We can definitely do the treatment in the sujog. Sujog is also very effective. If someone is suffering with the itching in the ear, so we are having 1.99.08, which is in my next which is next upcoming point. We'll learn. And till that time, you can use 11.1, and I will also note down this point and I will discuss in the next. Kindly put whoever, whatever you feel that problem is happening more commonly all around, you put in the group. So next workshop we will do on that problem only. But that problem should be common, because if you ask the problem your individual problem and that is not common problem, then it's difficult. If you ask any problem like skin problem, like rheumatoid arthritis problem, like itching problem, we will discuss definitely. You put in the group. So next time we will discuss that point only. See, after menopause or after hysterectomy, body pain is very common because of hormone change, because hormone are lesser. As per the acupuncture also, Shen, Shen or Jing, body essence is becoming lesser. So the lower three emperor are very good point to improve this condition. Lower three emperor. No, no, no problem. Yeah, yeah, we can do. Not a problem with the numbers. Not a problem with the number of a student. We can do with any number. Either the 50 student, 100 student, 200. No problem. I will upload this video definitely for everyone. Okay, so I will include more point related with the COVID and the viral infections and the lung disease and the lung disorders. Definitely, I will take care of that point. I will add that. Masterdom also has been given 8 point, 99.01234567 point in the ear, in the auriculotherapy. They are very much effective point, very, very effective. You can combine auriculotherapy with the masterdom. 77.17, 19 and 21. 77.17, 19 and 21. So you can do one thing in the group. You ask me, I will post the video. I am having this video of lower 3 emperor, and where I have demonstrated the how to insert the needle with the location. Then I will put that video and you can see. Weight loss, we will not discuss. Weight loss is a very, if we will discuss the weight loss is a total, is separate topic. Sometime we will make the plan to discuss the weight loss. But when we discuss the weight loss, we will not discuss anything else because weight loss required full extra attention. Okay, so we will also focus on the male genital problem. So I will make the list, whatever you have told. Okay, rheumatoid arthritis, skin problem, COVID, lungs, and male genital problems. Okay, we will discuss that. Eczema, yeah, eczema we will discuss. Paralysis need extra attention. For the paralysis, you should go for detailed master tongue acupuncture. Because in the detailed master tongue acupuncture workshops, we will discuss multiple points for paralysis. Thyroid. Okay, thyroid we'll discuss. Okay, so now most of you asking the protocols. I understood. You need some protocol, how to treat any disease with the help of protocol. And most of you asking very common problem. So we will discuss. Because just I will tell you, like frozen shoulder, you use Shengguan. I think it will be not enough for you. If you're asking, I will just tell, I have to tell the location. Okay, fine. Dr. Sunilji, very nice. You can make a list, but not very bigger list. Short and sweet. Thank you so much. Yeah, so this Dr. Mr. Faris, instability when walking, can't control the legs, possible to heal? Yes, definitely. It is possible to heal. How? We have to increase the dopamine hormone. In the master tongue acupuncture, there is an upper three yellows point, 88.12, 13, and 14, 88.12, 13, and 14. These are the points called upper three yellows. They are the very effective for bringing the stability when walking. They are very good for controlling action of the legs. And with that, we have to add the DU24 point, where female putting the sindoor, because this point is basal ganglia point and increasing the dopamine hormone. So if you put the question in the group, I will post the video. See if whether it is possible for you after seeing the video, if you can insert the needle, then you can do that. For uterine fibroid 11.24, there are multiple points for the uterine fibroid, like 11.24, 11.06, lower 3 emperor, 3 sisters. There are multiple points for the uterine fibroid. But 11.24 is the primary point. I will definitely share this recording, definitely. Okay. So thank you so much. Dr. Sunil Jain will post the list of the common diseases. So he will see the question asked by all of you. Then he will make the list and he will give me, he will post in the group. So I will do accordingly. No. In the master tongue acupuncture, we don't see any disease in that way. like heart blood deficiency, liver blood deficiency. Like in that way, we don't see any disease. That is the part of TCM. And but that is a very beautiful part of the TCM because that will make you diagnostic master. But in the master tongue acupuncture, the approach is direct. Heart problem, these points, either excessive or energy or poor energy. Yeah, yeah, yes. So thank you everyone. Thank you so much, all of you, to giving your precious time. We will meet shortly. As soon as your list will be ready, so I will announce again this workshop for 1 or 2 hours. Okay. So we will do within 3-4 days only. Not we will not take more days. Within very shortly we'll do. No, you have to post in the group only. He is Dr. Sunil Jain in the group is available in the group only. Okay. So 2 group link we have seen with a Zoom link. You can post in that group only. If someone is suffering with excessive heart rate, that is called tachycardia, 11.05. Very excellent. 11.05. There are many other points also. Many other points. But 11.05 is one of the very good point. Because today we already discussed, so you know this point. So you can add this. Angle, direction is not important. Depth, definitely. Depth is what? So depth, when we are inserting the needle, depth depends on the location. Like if you are inserting the needle in the finger, depth will be very short, like 1 fan, 2 fan. Like in the one chun can be divided in 10 fan. 1 chun is equal to 10 fan. So when you are inserting the needle in the finger, it is 1 fan, 2 fan. But when we are inserting needle in the thigh, it is 1 chun, 2 chun. So depend on the location. But initially, you can use 1 chun needle and you can use 1 chun needle everywhere. 1-inch needle. If possible, like you're putting in the lower leg or thigh, you can insert complete needle. But if you're inserting in other areas, you can insert half needle. And when you are inserting in the finger, you can use that needle or you can use Sujog needle. Yes, white discharge, irritation, anger, we can use Foucault 11.17, both. Okay, dear friends. So now I am closing the meeting. See you very shortly. Thank you so much. Good night.